Today's question is, why does a child get febrile seizures and what can we do about it? Hi, welcome to my YouTube channel. I'm Stephanie, aka The Healthy Practitioner. I'm a board-certified family nurse practitioner specializing in functional medicine. I've been doing this for over 10 years, and I'm here to help you live your best and healthiest life ever. On this channel, we talk health, wellness, and all things detox. So as a mom and practitioner, I've had friends, family members, and patients with their kids that have had episodes of febrile seizures. It's alarming, right, to be a parent and witness something that is just scary and not knowing when it's going to come again or what the cause is. So looking at febrile seizures, it can be a genetic predisposition. So if you have a parent that had febrile seizures or siblings, the increased risk for a sibling or another family member to have them is higher. The reason that febrile seizures occur is that the brain and the immune system, nervous system are not fully developed. So there are sensitivities in that system. So it's not really the temperature that's causing the seizures. It's not because it's 105-degree temperature. It's the rapidity. It's how fast the fever forms. So if a kid gets a viral infection, which is typically something that stimulates it, their fevers rise quickly. And when it's rising too quickly, their brain can't adapt to that, which can create a seizure. Another occurrence can be that when a virus happens, it releases a bunch of cytokines, some inflammatory processes in the body, which can then again over-trigger the immune response, creating disharmony within the brain and the nervous system, causing the seizure. So again, the goal for helping one prevent this long term is supplementation, keeping the immune system strong. And we can do that with vitamin D, zinc, DHA, like omega-3 fish oils. That is one of my favorites to help with brain inflammation in general. And I've seen that work with parents giving it to their kids to prevent any febrile seizures. I know I was just talking to a parent that her kid's DHA ran out and she hadn't had a seizure in at least a year and a half. And then 2 months later had another seizure when she had a virus. So the DHA was really keeping the inflammation down and allowing the brain and nervous system to connect well. So to me, DHA, fish oil, really important. Hydration is another really important and key during acute events and prevention as well, making sure that your child is staying hydrated. So what happens when your child is starting to get a fever? And we know ibuprofen, Tylenol, not the greatest pain relievers. We don't want to use medications for our kids, right? Also, I don't want you to feel guilty. Like you have to do what's best for you in the moment to get through whatever is going on. So if that's what you have to do and that's the tool that you have, then use it, okay? So Tylenol can deplete glutathione in our body. Glutathione is a major antioxidant. So it just is that trickling that we just try not to have happen, right? It can increase risk for allergies and different types of diagnoses. So we try to avoid it when we can. Again, if it's the only tool that you have and a lot of times fear drives it all, then do what you feel comfortable with. But if you're looking for alternatives, when you notice the first sign of fever in your child, decrease the clothing, give them a warm bath. You don't want it to be hot, but you also don't want it to be cold because if it's cold and they're shivering, the shivering process will actually increase the fever. You can use herbs. Chamomile would be good. Any child over 1 can have herbs. You can put it in the bath. You can have them drink it, mix it with their milk, whatever you want to do there, but just getting them comfortable, making sure that the temperature in the house is not over 72 degrees, not layering on blankets. So keeping them hydrated during that time as well. Cold, cool compress on neck and forehead can help. So anything that you can do to just slowly rise the fevers versus make the fever happen really quickly will help decrease risk for febrile seizures. So I think that is all for today, but hopefully this is helpful to you. Again, I am just thinking of any parent that has to deal with this because I know that it's a struggle, but just keeping their immune system strong. Usually the febrile seizures last between ages 1 till 5. So knowing that you can get through this, but detox pathways open, keep them calm and comfortable, and know that you have a lot of tools in your toolbox if this does occur. Have a great day, and we'll talk soon.